It's a sellout crowd of 5 at McCormick today as we get ready to listen to the locker room doctor, Mike Evans, chat about health. So close those internet browsers asking about the mysterious color of your pee. We've got all of your health answers right here. We're in the locker room today talking about benign prostate hyperplasia. Why you pee so much?
Dr. Mike, I'm finding as I'm getting older, I have to pee more during the night. Get up several times, and it's become a bit of an issue for my wife actually, because when I get out of bed, it wakes her up. So I guess my question is it an issue to be peeing several times during the night?
Incredibly common. Hear that all the time. It's part of the kind of normal aging process. We've got medications. We can treat it. We can solve your wife's problem.
Okay, great. Well, let's hear what the guys in the locker room have to say about it.
Well, Mike, I'm finding that at night when I get up to pee, it's a little more difficult for me. You know, I'm more squeezing to get those drops out.
As we get older, so probably past 40, a lot of people, their prostate gets bigger. So your prostate is a kind of walnut-sized gland, and it sits under your bladder. So if your bladder's here and it's full of water, and you have your pee tube, your urethra going out to your penis. And then as you get older, two things kind of happen. It gets bigger, and that's called benign prostate hyperplasia. Hyperplasia is just benign growth. And it just sort of squeezes that tube. And so when you fill up your bladder with water when you're 19, it just goes out, and it's more of a fire hose. But when you're older, it's squeezed, so the tube's just not, can't process much. So when you pee, you only pee out this much. So that means you're getting up 2 times a night, going pee. It sometimes means you have to push it to pee. It sometimes means you dribble more. So these are all signs of benign prostate hyperplasia, which in no way indicates that you have cancer. It is interesting. We used to think it was just a large prostate, and now when we do studies, some people have smaller prostate. It's just more sensitive. And then the TERP, which is, this is a bad term to use in front of men, but it was like a roto-rooter that went around your pee tube and just gave it room, kind of thing, was the most common operation in the US up until about 15 years ago. And now we have medications called alpha blockers. So alpha blockers, there's receptors on the prostate, and it just loosens the prostate. And so so when you're peeing, you just can pee the whole thing out, so you're peeing less often.